Hi, my name is Declan Cameron and welcome back to my channel. Today I am going to be talking about borderline personality disorder and how it affects me on a daily basis. I'm just going to put a disclaimer out. I am not a professional, I am not a doctor, I am not a therapist. This is a diagnosis that I have recently got since I turned 18. And I just wanted to talk about it a little bit and bring awareness to it because there's a lot of stereotypes to this disorder, and many people think, oh, you're just bipolar, and it's actually bipolar and borderline are actually two completely separate things. So I wanted to talk about them. So yeah. So let's talk about the definition of BPD, which is borderline personality disorder. It is, quote, a personality disorder characterized by severe mood swings, impulsive behavior, and difficulty forming stable personal relationships. I struggle with relationships a lot. Friendships, family relationships, like romantic relationships, I struggle with them a lot. Just because I feel like I'm not good enough for anyone. And there's actually 4 subtypes to borderline personality disorder, and I will talk about each of them and then explain which one I am and how that affects me. So there's the impulsive subtype, and I'm reading on my computer because I took notes. Impulsive borderline, people who have this subtype are usually prone to erratic actions, as the name implies, and likely be energetic and charismatic at times and cold and hostile at other times. I personally don't have this subtype. I know people who have this subtype, and it's really difficult, not just for the person who has it, but for the people around them, because you never know what mood they're going to be in. You never know when it's okay to say something, when it's not okay to say something. That's also been really, really hard. Petulant borderline is also referred to as the angry subtype. Those who suffer from it can waffle between feelings of unworthiness to explosive anger, and can also be fearful, anxious, possessive, controlling, and jealous. Again, I don't have this subtype, but I hear people who have I call it the anger subtype. So people who have the anger subtype struggle a lot, and like they kind of like isolate themselves because they're afraid to get mad at someone and lash out and like hurt their feelings and stuff. And then there's the discouraged subtype, which is the one that I have. People with this subtype are often clingy and passive, as well as reliant on others. They tend to turn their feelings of anger inward and are prone to episodes of mutilation and suicidal behavior. I have this one. I am very, very clingy to the people that I care about a lot, and I'm also very touchy-feely person with just a few selective people in my life. So like my friend and my aunt are the only people that I actually like touching me. Like I actually want them to hug me and stuff, and that's also been really difficult because people will be like, oh, can I have a hug? And I have to be like, no, thank you. I don't like being touched. And I also turn all of my feelings inward. Like I like never cry anymore. And I actually lost my friend to suicide this past weekend. And the first time I cried about it was last night, because I was like, this didn't happen. And I was kind of internalizing it. And the last, subtype is the self-destructive. These people likely harbor intense feelings of bitterness and self-hatred, leading them to self-destructive behaviors. Like, let's say, like jumping off a bridge, or like very, very, oh God, what's that word? Like impulsivity. Like they're very impulsive. And let's talk about some of the symptoms. Let's start with behavioral. Antisocial behavior. Like for me, how I go like with that is until I am warmed up to you, I am very closed off and I am very quiet. until like I get to that point where I trust you completely, and I have like crackhead energy. Like, people tell me to calm down and go take a chill pill most of the time if I'm comfortable with them. Compulsive behavior, hostility, yeah, impulsivity, irritability, risk-taking behaviors, self-destructive behaviors, self-harm, social isolation, or lack of restraint. Those are the behavioral symptoms. The mood symptoms are anger, anxiety, general discontent, guilt, loneliness, mood swings, or sadness. Anxiety is also a really, really big one in borderline personality disorder. Most people have to go on medications. Not all people, but some people have to go on medications just to control the anxiety, and sometimes that doesn't even work. Sorry, I'm in the park, as you can probably tell, so there's gonna be cars driving by. Psychological, depression, distorted self-image, or narcissism. I do have narcissistic traits, and I try my best to not have those and to like work on myself through therapy and through finding who I am. And yeah. And then also common with borderline is thoughts of suicide and suicide attempts. Because people with borderline aren't understood by sometimes not even doctors or therapists. It's really hard to be like, well, I need to get this stuff out and I need help and I cannot find this help. I'm a failure. I'm worthless. Like, that's how some people think. And so yeah, this is just those are some of the symptoms. And I'm not going to talk about what the criteria of the diagnosis is, because people like to diagnose themselves with disorders like this and like to fake them. So I'm not going to talk about the criteria. But you have to meet at least 5 out of the 7 criteria to be diagnosed with BPD. And I fit 6. So I was diagnosed. And there's a lot of different treatment options. There's hypnosis, there's a lot of different treatments, and the one that has worked best specifically for me is dialectical behavioral therapy, or DBT. I do 3 therapy sessions a week, individual, and a group DBT session. And so in the group DBT session, which is a weekly thing, is on Fridays, and we talk about these coping skills that we can use to when we're in distress and we need something right then. And then I go to therapy with my individual therapist, and we talk about those skills and we learn how to apply those into everyday life. Okay, and how it affects me on a daily basis. Borderline is also, it's driven by a fear of abandonment, and it is a learned trait. It isn't a chemical imbalance, so meds don't really help. They can help treat the symptoms, but it won't, like with bipolar, you can take medication and the bipolar will basically go away. But with borderline, it's always going to be there because it's not a chemical imbalance. So you could treat the symptoms with medication, but it won't always work. Something that I also do is I apologize for everything, because everything like goes wrong around me, I think that it is my fault. Somehow I did something to make this specific person uncomfortable. I did something to make this person pass away. You know, I wasn't there. You know, I think that's my fault all the time. And so I apologize for everything. And I always think people are mad at me, or people are upset with me, which isn't always the case, but I'm a very paranoid person. So how do I put this? Like, I think everyone is against me all the time, and I feel like I have to prove myself to everyone. And something that I struggle with a lot is mood swings. So I could be happy and like very talkative one minute, and the next minute be sad or closed off and like not talking at all. But you know, this is just something that happens to me, and yeah. And I don't know, I'm not a doctor, so I can't really tell you anything about borderline except the stuff that I know and the stuff that I deal with. So I guess I'm gonna end this here because that's all the notes I took. So thank you for watching and have a great day.